your way with your local AAA. Thank you so much for joining us. In my position as outreach specialist, I often have to do presentations in the community, and sometimes they're long and sometimes they're short. And today we're going to walk through a 3-minute version of all that we have to offer at Area Agency on Aging of Western Michigan. Thank you for joining us. Area Agency on Aging provides services because there is no place like home. We often get the question, what is an Area Agency on Aging? Which is a great question. And to start, they started in 1974 as actually a nationwide network of nonprofits created by Congress. And what they're intended to do is create a one-stop shop for home and community services for those who are aging in place. And don't we know that most people do want to age in their own homes and communities? As a matter of fact, statistics say that 3 out of 4 would like to age in place. And then it also helps to maximize independence to work with an Area Agency on Aging and reduce the cost of long-term care. So who are we, specifically the Area Agency on Aging of Western Michigan? Well, we do provide services for over 35,000 clients each year with 80 plus unique services that are provided. And of course, in order to make that happen, we have to have agency partners, which we have over 60 of those. And then our mission is to provide person-centered care with Area Agency on Aging of Western Michigan, where you as an individual have autonomy in the resources and programming that you can choose. Funding is provided by a variety of different places, including federal funding, the Michigan Department of Health and Human Services, the Bureau of Aging, Community Living and Supports, and the Kent County Senior Millage. And we serve a very specific region. Every county actually in the United States is covered under the umbrella of an Area Agency on Aging. And our particular 9-county region includes Mason, Lake, Osceola, Newaygo, Mecosta, Kent, Montcalm, Ionia, and Allegan counties. Now, sometimes people ask, Liz, can you talk about our services in 5 minutes or less? And I used to say, I don't know if I can do it, but we have this nice graphic because of aging in place in the home and the community, where we've divided our services into the graphic of a home, where of course we have our general services at the top of the house. In the middle of the house, we have protective services for older adults. And then in the basement of the house, we have our foundational services. So let's talk about each one of these briefly. Our general services are available to anyone regardless of asset or income. And so we have everything from resources that have to do with fitness classes to caregiver support, as well as access to transportation in our 9-county region, as well as assistance with Medicaid and Medicare questions. And these are available to anybody to age in place and empower that caregiver or that person needing care to reach out for help. And then let's talk about our protective services. We have these services to protect and advocate for older adults with a focus on prevention and, of course, education. So we have advocates for senior issues that work at the legislative level, as well as the Kent County Elder Abuse, reaching to our 9 counties to help prevent elder abuse and provide education. And then also Dementia Friends Michigan, which helps to create communities more friendly towards those with dementia, as well as our long-term care ombudsman team, which are the advocates that help to advocate for those in a nursing facility. And then finally, our foundational services provide practical support for those with a higher level of care need, and the care is based on income and asset qualifications. So we have our 2 long-term care programs, which include care management, which provides managed care in the home, as well as more intensive care under the umbrella of the My Choice Medicaid waiver. We also have a program that helps to transition people back to the community from a nursing facility. And finally, we have our Choices for Independence visit, which is a free 1-hour consultation with a social worker from our agency. And we do administer the Kent County Senior Millage and the Older Americans Act, which is where we partner with our 60 plus partners to really help bring the services into the home in our 9-county region. If you have any questions about anything in this presentation, you can connect with us on our website at AAAWM.org, as well as just call our intake and assistance line at 616-456-5664. Thank you so much.